The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Welcome back to day 3 of training for the Housing Stability Services Program for your ERA2 contracts. Thank you for coming back for day 3. Today we're going to go through the monthly reporting and the housing contract system. That'll be the portal where you're going to enter all of your contracts. Alex is going to take the lead on our presenting today. Before we get started, I'll go through with a couple of housekeeping reminders. All the materials are on our website. The slides that are presented today already appear on the website. And then the recordings for all 3 of our presentations will appear there. I'm hoping by tomorrow. That it takes about a day for our information systems people to get that up and posted. Same as the last 2 days, we'll be doing questions as much as we can through the training, through different segments, or at the end of the training. And like I said, this training is specifically for reporting. So we'll try to address as many of the reporting questions as possible. If we do have time at the end and we're getting a group of other questions that haven't been addressed, we may have time to take that, but I'd really like to focus this on reporting. So if someone wanted to go back and only look at this video, they'd have all of the reporting information. So please send your questions as we go. Someone asked, where is the recording? It will be on the website. All of the recordings are going to be posted on this webpage that is linked right here on the first slide. And we'll send a listserv announcement out telling you that the recordings have been posted. So please sign up for the listserv. The link for that is at the bottom of this webpage. And we also went through that on day 1. So with that, we can advance to the next slide, which is the agenda. And I'm going to hand it over to Alex. So thank you so much.
Yeah, thanks, Kate. As Kate mentioned, I'm Alex Postelnik. I am a program administrator with the HSS program at TDHCA. I've been heavily involved in this reporting process, but I also want to shout out Meg Key, Surya Sharad, and also Kim Jones, who you have been in contact with about your contract benchmarks. This is a very intensive process, reporting for us, and it has a lot of moving parts, and nothing would be possible without them. I just have to be the one who talks about it today, but they're behind the scenes doing most of the work and doing a darn good job at it. So, but going on to our agenda for today, we're really going to talk about just the nitty-gritty with reporting for this program. So we're going to start off with the basics. When is reporting due? What is the reporting timeline? From that point on, we're going to go and discuss our housing contract system, which is our main system for expenditure and performance reports. It's also the system that will ensure you get your reimbursements, and then at the very beginning of the program, your advance. From there, we're going to go to another segment of reporting, which is your monthly household reporting spreadsheet. We're going to discuss how you submit this spreadsheet through the Smartsheet portal on our website and discuss the reasons behind using this spreadsheet and also how to use it. After that, we'll discuss next steps for reporting and get you prepared for your first reporting deadline, which is going to be in May, actually. So, and then question answer time. So let's go on to this reporting timeline and discuss specifically the monthly reports that you have to submit. All monthly reports are due on the same day. So it's on the 15th of each month. And these reports are going to cover all of the households you've served during that month, counted once, right? So any household you served during the preceding month is going to be in these reports, and any costs incurred in the preceding month is going to be in this report as well. So for instance, I believe the reporting deadline for for April, I believe it's May 16th. I don't remember off the top of my head, but that's because if a reporting deadline falls on a weekend, then the reports are going to be due at the end of the next business day. And you can find those reporting deadlines on our website here. But so that, I believe, May 16th deadline is going to cover all of your April reporting. So from April 1st through the 30th, every household served, and then your costs incurred as well. We're going to break this down a little bit more in detail, but in general, you're going to have 3 required reports. 2 of those reports are submitted through the housing contract system. This is going to be your housing contract system expenditure report, or your expenditure draw or reimbursement draw. And the second is going to be your housing contract system performance report. These are going to be your households that you've served. And the third is going to be the monthly household reporting spreadsheet, which goes through a different system that you're going to submit through the Smartsheet link on our website. So let's break down these 3 reports more in depth and the differences between them and why we have them, okay? So the first is going to be the housing contract system expenditure report. This is basically where you just plug in your expenditures for the previous month. We're going to get into this in depth, but it's going to be 3 main things. It's going to be your administrative draw request. It's going to be your general program or HSS draw request. And then it's going to be a draw request for those direct household payments. Next, with that is this expenditure report is what's going to determine and process your reimbursement amounts for program activities. So it's very important. This is what determines how much money you get and how quickly you get it, right? The second is going to be the housing contract system performance report. This is going to be an aggregate total of every household served in the previous month by certain categories. We will discuss these categories later. And this serves the purpose of tying your expenditure report in the housing contract system to actual performance, program performance. So federal administrative code specifically says that for federal grants, we have to do our expenditures based on actual benefits rendered, right? So it ties these together, say we serve these households, we've expended this amount, serving these households. The third is more treasury specific and specific to this grant, which is going to be our monthly household report spreadsheet. This spreadsheet reports detail level data of every household served in the previous month. So it's going to be every household you've served listed once. So we'll get into this once again later, but if you served a household in April, it goes on the April spreadsheet. If you serve that same household in May, it also goes on the May spreadsheet, but it's only listed once on each respective spreadsheet. This monthly household report fulfills a treasury requirement for ERA funds that we have to maintain I put inventory here, but basically a log of every household we've served and information about that household. So it's specific to this grant. And it also allows for more complete data analysis on our end. So when Treasury requires specific information, or the governor's office or so forth requests information about performance of the grant, we are able to use this information in order to calculate aggregates based on detail level data. The important thing is that your housing contract system performance report and this monthly household report spreadsheet are linked. They are linked, and this is very important because the aggregates you report for your performance report are going to be specifically the aggregates that you would get if you totaled up your monthly household report spreadsheet. So if you totaled up all the households in your spreadsheet by race, AMI, ethnicity, and gender, it's going to equal exactly what you're reporting in your performance report. And we'll discuss this more in depth as we go on. I also want to discuss real quick that there's going to be more resources for reporting on our website. So if you want more detail related to anything that we discussed today, our reporting guidance is in the handout section of this webinar as well as on our website. And then the second thing is come to our monthly virtual office hours. The registration link and schedule is on our website. And this is a great opportunity to just talk with us, get some one-on-one time. Well, you know, it's a group, but and also talk to other subrecipients about what they're doing and what their problems are and what their successes are. So there's additional resources that you can access. But let's dive into those first two reports we discussed that happen through the housing contract system. So once again, the housing contract system is our main system for processing and approving draw reimbursement requests, right? So this is very important because this is how you get reimbursed. It's how you get the money, right? So the housing contract system serves quite a few different roles in addition to that. It establishes kind of roles and processes for who can submit a draw request, who has permission. It also allows you to kind of monitor your budget and draw requests as we see it, right, in our system. So you have your own books. You can also see what we're reporting on our end through the system. It also provides for us a centralized database of all the organizations we work with, the contracts they have, and who the contacts are at those organizations. And lastly, and perhaps most importantly, if everything runs smoothly through the system, it allows us to reimburse eligible expenses as quickly as possible. I put the link for this is in the PDF of these slides as well as on our website. So let's talk first about user accounts and user roles within the HCS system. So I know many of you probably already have user accounts or work with this system or know someone who's worked with this system. But bear with me as we go through it. The first thing is user accounts for accessing the system are based on the HCS access form, which you have already submitted and signed to us. And the user accounts are limited to just who is listed on this form. So that's going to be your contract executor. Your contract executor automatically gets an account, whether they choose to use it. They don't have to be heavily involved in the reporting process, but they do get an account both as a courtesy and their right as a contract executor. And then it's going to be 3 other accounts. And we only allow 3 other accounts plus the contract executor. So that way we can limit and keep tabs on who has access to the system. If you have any sort of staff changes or you want to change who has access to the system, you will have to submit another HCS access form to the HSS@TDHCA email address down below. And we'll have to request new access for someone. And then we'll remove the one person from access to the system and add the new individual. So we are going to limit it to 3 plus the contract executor. With those forms, there are 2 primary roles that a user can have. These are going to be an external contract administrator and an external contract consultant. So the administrator can see, save, and submit draw requests for TDHCA approval. So they can press the submit button, they can send it off to us for us to approve and process that draw. The contract consultant, on the other hand, can see, enter, and save draw request information, but they can't press the final button. They can't submit it. We generally encourage you to use your 3 roles that you get to make everyone a contract administrator, just so there's some redundancy in who's able to submit draw requests. But if you choose to make someone a consultant, that's fine too. But just know that you're going to want someone available at all times to submit the request so it doesn't get stuck in the system. Finally, all requests to reset passwords or change roles should be sent through the HSS inbox. listed right here on this slide. So if you need to reset an account password or so forth, you can send a request through this. Okay, so the first thing first is if you go to the link on our website for the housing contract system. I'll actually pull it up again here. It's right here, and once again, this is in the PDF of the slides and on our website. So no one has, unless you have an existing account, no one has their account set up yet because the contracts aren't fully set up in the housing contract system. So many of you all won't be able to log in at this time, but rest assured, once again, this presentation and training is being recorded, so you can go through this when it is your time to log in and we have new accounts set up. If you're an existing user and you already have an account, feel free to follow along. But when you first get your account user ID and your temporary password, you're just going to log it into this right here, type it all in, and it's going to request that you reset your password. So you just type in your old password again, set in your new password, confirm your new password. If at any time you forget your password, this process will play out the exact same way. So one of an HSS staff member will send you a new temporary password. They'll type in the temporary password, do the old password, new password, confirm new password. So that's how that process works. Once you're into the system, you're going to see one of two things. You're either going to see the screen on the left here, which shows that you don't have any current contracts assigned to you. At this time, that probably just means that we have not assigned a contract to your account, which we will do in time. Or you'll already have a contract assigned to your account, usually because you are already administering a grant for another TDHCA program. So if you don't have any contracts assigned, it'll look like this. If not, you'll get a little notification list of what's going on with your contracts. Right here, we have a contract where a draw is pending. And you can always view any contracts that are assigned to your account by clicking My Contracts here. Next, viewing account notifications. So we already talked about this notification screen here. And there's a few things you should note when you're looking at this screen. It's just going to show any draws you've submitted. It's going to show you the amount of that draw. It's going to show you what program, and finally, the draw status. So draw statuses are very important because it's going to show you where in the stage of that reimbursement process we are. So there's a couple different draw statuses that are important to know. And these are pretty much everything that you're going to see. I don't think you're going to see anything different than these. The first is pending. This means that you've pretty much opened a draw request and you've maybe put some data in it, maybe you haven't, maybe you just opened it, and you can still edit it. So external users can still edit it. The next is pending PM approval. That PM stands for Portfolio Manager. That basically just means HSS staff. So it's waiting for one of us to approve it. That means you press the submit button, and now we're going to review it and make sure that everything is all right. The next is pending processing. This means it's awaiting approval from our financial administration staff. So that means HSS staff has approved it, and now we actually just need TDHCA financial administration staff to approve the direct deposit. After that, they approve the direct deposit. It's going to be an approved draw, and that's going to be ready for disbursement. Usually it's going to take, about 2 days for you to receive that reimbursement. If it falls on a weekend, obviously everything follows normal banking hours. So, it'll probably be the Monday or Tuesday if a draw is approved on like a Friday or a Thursday or so forth. And then finally is a rejected or rejected pending amendment. And this basically means that an HSS staff member has reviewed the draw request. They've determined that there's a deficiency in this draw request. There's something lacking or something we need you to fix. And they'll write comments to you. It'll generally get emailed to whoever your main contact is on your HCS access request form. And you'll get comments about fixing any issues you may have. And then you're able usually to resubmit that draw unless there's a significant issue. One second here, y'all. Okay, so next, let's say you have, you viewed your notifications, you viewed your My Contract screen, and I'm going to go back actually, and you click on your contract number over here, or you go to your My Contract screen and you click on it. And then what's going to happen is you're going to get to your main contract screen here. This is your main contract screen. This is a made up account. So nothing here is real besides the name of the organization and the executor. But we have a contract here. It's going to show you information just about who your main contact is listed at the organization, who your executor is, the status of the contract, and finally your total budget for admin, and then your program funds, all the way down to the amount you've drawn and the amount available to you. So, this screen is going to be your main screen that you pretty much access anything else with the contract related to. So we're going to discuss now submitting that administrative draw. So how does one submit an administrative draw? First, this is going to be a separate process than submitting a program-related draw. So you don't submit an administrative draw and a program draw in the same place. To submit an administrative draw, you can see in red here that you're going to go on the main contract screen to this draw request button. For your contracts, this draw request button here on the main contract screen only processes administrative draws. So if I go to this draw request, you're going to come to this screen here. You're going to put in your services rendered dates. So once again, this is going to be the preceding month to the reporting deadline. So if you're submitting a report in May, it's going to be that month of April, and you're going to do April 1st through April 30th. It's going to tell you that you have these required documents for approval right here. And if you click this documentation forms list, it's going to give you a bunch of TDHCA home documents. Rest assured, this is not needed for our program. So put down here that these forms are not needed for our program. So just check the box and then press save. When you get to the admin draw screen, processing admin draws are very easy. You're just going to go down here to where it says draw amount. You're going to put in your admin expenditures for the month. And then if you don't want to submit it yet, you're going to write save right here. And if it's ready to be submitted, you're going to press save and submit for approval, right? So if you save it, it's going to stay in the system, but you're not submitting it for approval. You're not submitting it for reimbursement. It'll allow you to come back, edit it, and then save and submit for approval. Next is submitting a program draw. I'm going to take a quick second to drink water here. But this is going to be, once again, a separate process. So to complete this process, you're going to go to this activities button up here in red, this activities button. This is very important. And this is going to take you to where you'll be able to submit a program draw. You'll see here that there's going to be an activity number that's going to have the address of your, usually your headquarters. It's going to be whatever's listed on your housing contract system access request form. And then you're going to click right here in red on this activity number button. And it's going to take you to the main activity screen. So this is the main activity screen here. If you're familiar with using this screen for other TDHCA programs, notably like home programs, a lot about this screen is going to operate differently for our program, and it's going to be much more simple. But one thing to note here is for ERA2 specifically, so this is an ERA1 screen. For ERA2, there's going to be one massive change, and that change is just going to be on this screen. You will not see these two broken out by allocation. Everything is just going to be in your Housing Stability Services project, funded, available here. Do not worry, because everything is going to work exactly the same, except you're just not going to see, two items here. You're still going to break out your program draw by direct household payments and Housing Stability Services, general Housing Stability Services. You just won't see this top part right here. So next, you're going to click Draw Requests down here. And then we notice that there's already a draw in this system. It says it's pending. Once again, that means it's able to be edited by one of your external users. But let's say we want to create a new HSS draw request. We're going to go over here in red where it says create a new draw request. And the same thing, we're going to check the box for all required documents. We're going to put in our services rendered dates, and we're going to press save. And then this will create a draw request for you to edit. There's two important things from this screen. So remember we talked about earlier that you're going to submit, two reports through the housing contract system, your expenditure report, which is going to be your admin and then program draws, and then your performance report. Both the program part of your expenditure request, or expenditure report, and the performance report happen on this screen, right? So this is going to be your expenditure report here, and this right here is going to be your performance report. You're going to need to submit both of these for this draw to get approved. So it's not going to let you submit a draw request unless you fill out this performance report. So we're going to talk about this performance report first. So if you click on this button here, this is the screen that comes up. Once again, this is aggregate data for every household served in the preceding reporting month. It says unduplicated here because every household you've served in the previous month gets counted just once, right? It gets counted just once. So if you served a household every single day of the preceding month, so you serve it 30 times, it still only gets counted once on this form and counted once in your monthly household report spreadsheet. So that's what unduplicated means in this case. It means within a reporting month, it gets listed one time. And once again, this is just going to be aggregate numbers, right? So it's going to be the number of households you served by AMI category. We talked, yesterday's training about AMI a little bit. We put those income limits up for you. So please review that training for a little bit more on AMI limits. And if you have any questions about that, you can also contact us. Next is going to be households by race, ethnicity, and gender. Hold off right now on maybe any questions related to, how do I collect race and ethnicity and gender data by household? Obviously, this is a very tricky question, and we'll get to that when we actually discuss our monthly household reporting spreadsheet. So hold that question for right now, but you're going to do the household served, and this screen will not let you proceed unless all of the categories add up. So once again, this should be your total number of households served in the preceding month. If you have for total race, you have a 9, you put 9 households in here, and for total ethnicity, you have 10, it's not going to let you submit the report. So make sure everything adds up. And once again, make sure that everything is correlates directly to your monthly household reporting spreadsheet, which we're going to get to after this. Another thing to note is I deeply encourage you to use the save function for the performance report until you're absolutely certain you're ready to save and submit for approval. Because once you save and submit for approval the performance report, the only way you'll ever be able to edit it again is if we issue a deficiency for the draw, which basically means we're just kicking it back to you to re-edit. It sounds really scary, but it really just means, hey, there's something a little bit off. We're sending this back to you. You'll get an email saying with notes on what was wrong. So really don't save and submit this for approval until you're absolutely certain your numbers are right. But once you put in all of that, you're good to go on your performance report. I should say I made a little bit of a mistake here, and I am going to back up. But the mainly because this is so simple. But obviously, that's your performance report. The process for submitting your expenditure amounts is you're just going to plug in the numbers here, right? So you're going to plug in the amount you've spent on general housing stability services and the amount spent on direct household payments. You may ask, what is a housing stability service and what is a direct household payment? We're also going to get to that question in a moment. But for right now, the hard and fast rule is if it's not a direct household payment, it's a housing stability service, right? So almost all of your staff, case management costs, meal and hygiene costs, everything like that. If it's not a direct household payment, it's a housing stability service or an admin draw. So, but we'll discuss that as well. Okay, what happens after you submit a draw? Well, this magical thing happens where the status just changes to pending PM approval. So it's just telling you, hey, you've submitted this for approval. HSS staff is going to review it. And we usually, if it's submitted prior to the reporting deadline, so let's say you submit your April report on May 1st, you're ready to go. It might take like a day or two for us to get to it and to approve it. Certainly within the week, certainly. But if it's submitted at the deadline, then obviously we're in full reporting mode and these get turned back quick. But give us a little bit of extra leeway if you submit it very early in the reporting period. We do encourage that. So submit early when you have it and you're ready to go, because it means you get funded quicker, right? You get those reimbursements quicker. But that's generally our timeline. And once again, if we approve the draw, it'll go to pending FA approval. then it'll go to approved, and then you'll get your money to wherever your direct deposit is listed on your direct deposit form. Okay, so now that's how you submit a draw. That's the process. But a draw request won't be approved unless you also have one other thing. And this is your third report, and it's very important. That's going to be your monthly household reporting spreadsheet. Going to take a break for water once again. So with monthly household reporting spreadsheets, this is where we'll talk about direct household payments. So I'm going to pull up our spreadsheet. I'm going to show you how to submit it on our website. So I'm actually going to take us out of the PowerPoint here for a moment. But first, let's talk about direct household payments without getting too in the nitty gritty, because we really can with these. But what is a direct household payment? So there's a few things you're going to have to track. The first is, did a household stay in an HSS funded hotel or motel in the reporting month? Why is this important? Why do we need to track this? Well, one of the direct household payment categories is short-term payments for hotel and motels, right? Well, we've had subrecipients say, what if I want to pay for a hotel motel stay for a client all at once, right? I want to pay it all at once, and this is going to go over, like, let's say I pay it up front on April 28th, and that client stays in that hotel through May, right? Well, how do I report this? Well, you're going to report the short-term payment just in April, because that's when you expended the funds. That's where you cut the check. But you're going to put that the household stayed in a hotel or motel in both April and May. So that way we know that short-term payment, served both months. Other things that are direct household payments are going to be rent deposits, pet deposits, and application fees, utility deposits and utility reconnection fees, and landlord incentives and risk fees, right? So these are the things that are direct household payments. And if it's not one of these things, it's going to be a general HSS program expense, right? So that's the rule once again. If you're asking, oh, is this an HSS expense or is it a direct household payment? If it's not one of these, it is an HSS expense, right? So, and we're gonna pull up now. Once again, we're gonna get away from our PowerPoint. We're gonna pull up our website. So we can talk a little bit more about direct household payments through this process. Here's our website here. And unfortunately, I never remember the hotkey for Zoom. It's Control+. Okay, that's good to know. Here's our website. You'll notice the slides for today are on the website right here. I think when I scroll down, it's going to mess up my drawing. So I'll delete it. And then if you go down, you'll see our monthly performance and expenditure reporting section. There's a few things to note here. Here's the submission deadline for monthly reports. I was right about April reports being due May 16th, Monday, May 16th. And then the registration link and the dates for all of our office hours. So this is all important information. Additionally, up here above it, you'll see where you can find the monthly report by household spreadsheet, as well as anytime we might update it. The two submission portals for submitting the spreadsheet. So the ERA1 portal is only going to be used for ERA1 grantees. So the one you'll want to use is this ERA2 submission portal for the spreadsheet. And then the link to the housing contract system right here, that was an awful star. And as well as our HSS reporting guidelines, which you can also find in the handbook. So lots of useful information on our website. If there's ever updates to this, we'll do a listserv announcement for, especially for program guidance. But let's dive into this monthly household reporting spreadsheet. So if I were to click, oops, my screen just went out. Okay, it's back. If I were to click on this monthly household reporting spreadsheet, it's going to pull up this right here. It's going to pull up this spreadsheet right here. And let me as well see if I can zoom a bit. Let's do 125. There's a few things to note with this spreadsheet, and I could probably spend another hour just going over this spreadsheet and every single category that's in it. I'm not going to do that. I'm not going to torture you all in that way, but rest assured that there is an instructions guide and data dictionary right here, as well as the fact that there's additional information about this spreadsheet in the reporting guidelines. So really look at this spreadsheet, look at the reporting guidelines. If you still have questions, you know, gather all of your questions and send it to us, or you know, you can, and we'll be happy to answer them, right? So there's a lot of good information written out, but so use this instructions page. There's going to be three main tabs on this spreadsheet. The first is going to be the monthly household report. This is going to be your log of every household served in the last reporting period, marked once again, marked once. This meal services only tab is only for a select few subrecipients who have been approved for kind of large scale meal programs where it's very difficult to tie services to individual households. If you have been approved to do that, you would probably know about it by now, and we would have you submit the amount of meals served in the reporting month right here. This is not for instance, supplying groceries or food to clients individually, right? This is very specifically for large-scale meal programs for very specific ERA2 subrecipients. And the final is this payment corrections tab. Just note that it's here for right now. We're going to discuss the main monthly household report, and then this tab will make sense. Back to the monthly household report. I'm not going to cover everything in detail, like I said. We're going to touch on a few main points, a few, you know, stick-on areas where, you know, people have had questions about in the past. The first is this unique identifier here. This is just going to be a number that you assign to that household at intake that de-identifies them, but still allows, for instance, a compliance monitor HSS staff, whomever, if there were a need to go, okay, so can you pull me the file of household, 1, 2, 3, right? And you would be able to pull that file and see more information about it. But on this, for this purposes, it should not be directly identifiable. So don't put social security numbers in there. Don't put passport numbers. Don't put up, I'm trying to think, don't put initials for people's names. Nothing that directly links it to a specific household, except for the fact that you have kind of a key that you use on your end that links it to the household. So no identifiable information. The second is this first-time subrecipient of HSS funds, right? So we've mentioned that you're going to list every household you've served in the reporting month here. You may ask, well, how then do we track if a household has been served for the first time? How do we track unique households served? Well, it's two things. It's going to be this unique identifier, as well as this first-time recipient of HSS category, right? So if you serve that household for the first time in this reporting month, it's your first time serving them, the first time logging them on a spreadsheet, you're going to click yes here and no there. And no, so you're going to do yes if they've been served and no if they've been previously served in a previous reporting month. Household zip code, household county, household size. There's more about these in the guidance. Zip code and county, if the household is experiencing homelessness, can just be the point of service. Household income should be annualized. There's actually no other good way to be able to calculate area median income, so AMI, without annualizing their income. There's information on how to do this in the program guidelines, as well as in your completed contracts once we get those to you. Different methods for annualizing income. Gender of applicant, right? So we generally say gender of applicant, so whoever's primarily applying for assistance. If you usually do head of household, you can do head of household, just make it consistent, right? So if your current intake process is for head of household, continue to do that, just make it consistent. The same thing applies for race of household and ethnicity of household. For subrecipients who don't currently have a methodology for doing race and ethnicity intake for households, we have suggested that you do this based on self-identification. So whoever the applicant is, just ask them, how would you identify your household out of these categories, right? How would you identify your household? And that's what we suggest, but if you are doing head of household, that is okay, just make it consistent. Don't, do head of household for 1 year of the grant and then switch to self-identification for the, well, it's all self-identification, right? So, but the difference is head of household, you ask the head of household, what is your race? What is your ethnicity? For, for what we're suggesting, it would be how, what do you consider to be the race of your household, right? So actually having them not report on their self-identification of their race, but of the race of their household or the ethnicity of their household. For these categories here, these are the categories that Treasury has given us, right? So I understand that some of these categories might not be satisfactory. Some of them might be antiquated. these are the categories that we are given for Treasury, and you have to report households based on these categories, right? So generally, you're going to want to collect at intake household information based on these categories. But if you already have a process or a system in place for intake that is, very close or similar to these categories. So an example is you, instead of having, Black or African American for race of household, you might just have, an African American category, or you might just have a Black category, right? It's okay to just transcribe that into Black or African American within reason, right? I know some subrecipients collect race of the American Indian or Alaska Native category as, for instance, like Indigenous American or so forth, things like that. Once again, we need it specifically to be in this format. It needs to, when it comes on the spreadsheet, it has to be American Indian or Alaska Native. But if the categories are, can roughly be equivalated with one another, and you have a process and a policy for doing that that you stick to, that is okay. But these are the categories we need for Treasury. And then some more demographic data for demographics. And then finally, direct household payments. So once again, the household gets listed once. So these are going to be totals for every one of these that they have received in the reporting period. So if they receive a security deposit one day, a utility deposit another day, and then a landlord incentive another day, they get listed just once, and all three of these get listed here. We generally say to list out for the month in which these funds were expended or the check was cut, not necessarily when the check was received, right? So that's the general rule. If you have problems or concerns with that, talk to us and we'll work out a consistent method for how to report this. But generally, when it's you cut the check to the landlord or so forth, that's the month in which you're going to report these. Which brings us to the payment corrections tab. So once again, what happens if you write a check for a security deposit and it bounces back, or that household doesn't end up moving into that unit? Well, what you're going to do is you're going to report on this payment corrections tab that household 123, we've got a returned utility deposit for $300. Oops. I think I have to do negative. There you go. And what it's going to do is it's going to make it so your total direct household payments is less $300. And that's so this total here, your direct household payments amounts, and so if I were to add up all of these for the month and all of your payment corrections, it should equal the amount you're requesting in the housing contract system. So if you requested in the housing contract system like $4,700, then it would look something like this. $4,700. Because you expended $5,000 on a household, but you had a returned check that you're going to recycle into the program from the previous month, and you've already been reimbursed for that check. So therefore, it equals $4,700. The final thing I will say on this spreadsheet is it is a locked spreadsheet. You can only insert these categories. There are drop-down menus, and it'll give you a data validation error if you don't use those categories. If you choose to submit to us an unlocked spreadsheet, please make sure it is in this format. It looks exactly like this. And make sure that these formats are exactly right. And that includes like adding spaces onto the end of an entry, right? If the categories don't exactly line up, it messes up our ability to analyze the data, to compare it with your draw request, and you will get a rejected draw request and you'll have to resubmit in the right formatting. So just make sure every household you put in here is correctly formatted. Let's say I were to save this spreadsheet. I have it all my data in there. Where do I submit it? Where do I submit it? So if you were to submit this spreadsheet, you're going to go to the ERA2 monthly report by household tab here. It's going to open our portal. You're going to pick your subrecipient name. This is by contract number and also alphabetically, because contract numbers are alphabetical by the legal name of your organization. So all the organizations are listed here. You pick your organization, you pick your contract number, which is also assigned to your organization. You're going to put in your main contact for reporting, name, title, email, whoever you want someone to get in contact, like whoever we should contact if there's a problem with the spreadsheet. Phone number of that person, the reporting month and year, going all the way to the end of the grant, and the report version. What is the report version? Well, if it's your first time submitting a report for the preceding month, it's always an original report. If there was an issue with your report or you need to make modifications to it for the preceding month, right? So if you submitted a report on May 16th, and there was some data that was wrong with it, and you realized it, or we asked for a corrective report, and you get back to us on April 17th, because you're very expedient, you submit a corrective report, right? So original report is the first one you submitted, corrective report is any after that. And then you're just going to upload your spreadsheet. When you upload your spreadsheet, please, 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 please put your organization name in the file name. Maybe even put the reporting month in the file name. So once again, if you submit in May, the reporting month is April. And have the name of your organization in the spreadsheet as well, where it says name in the spreadsheet. This makes things so much easier on us just to put your name on the file, put your name in the spreadsheet. We don't have to go digging around to see who submitted what. So once you submit that, our staff is going to look at that report. We're going to make sure that everything looks good with it. And we're also going to check it against your draw request in the housing contract system. If both those things check out, you have an approved draw and you're going to get your reimbursement. So that's how you submit the monthly household reporting spreadsheet. And we're right near the end right now. Just final reminders, only submit the spreadsheet using the Smartsheet link on the website. Please do not submit any other documents through the Smartsheet link. So no HCS access forms, no contracts. It's for reporting only. Do not submit more than one spreadsheet per reporting month unless HSS staff approves you to submit a correction, right? This keeps it from being you submit 4 original reports and we don't know which one's the correct one. Do everything you can to ensure that data is submitted promptly and accurately. Once again, the quicker you submit a report, but also the more accurate it is, the quicker you get reimbursed. And the final, we've already talked about, unique identifiers should not contain personal information. Okay, so we're wrapping up now. Let's talk about next steps. So within the next week or so, we're going to, it could be a week or two, but probably within the next week or so, TDHCA staff is going to reach out to you with account credentials, including your temporary password. If you're an existing HCS user, housing contract system user, they're going to inform you that a contract has been assigned to your account. You're going to log in, reset your password, and then you're going to submit your reports by that Monday, May 16th deadline. Remember that delays in reporting will delay your reimbursement, so they're tied together. Before a draw for 1 month can be, like a future month can be approved, all of your draws for the preceding month need to be approved and entered. So if you wanted to draw for an April report, then March report draws have to already been approved, right? So if we're really delayed in reporting, then it's going to also affect future draws. The final thing is to contact us with any questions you may have. And with that, question and answer.
Hi, thank you so much, Alex. That was a lot of very detailed information. We actually don't have a large number of questions, which makes me think that you have covered everything in such great detail. So thank you so much. I anticipate we'll get a lot of questions as you actually go into creating your reports. After you've been through a month of administering your program, it's time to submit that first report. Please review this information, review the guidance that is posted on the website, and contact us with questions in advance. Please don't wait until after the deadline. The next day, that's the first we've heard from you that you're having a problem. Please reach out to us in advance if you're having a problem, if your numbers aren't adding up, if you're not going to be able to meet the deadline for some reason. We absolutely do want you to try to meet the deadline, but we know things happen. For example, in January, a lot of organizations had some staff outages because of case numbers. Reach out to us ahead of time and let us know so we can work with you, so we can plan our workflow to getting those reports approved and then payments out. I'll say it one more time. Please do not submit a late report, and that's the first time we've heard from you. We really need to keep on top of the activity and the expenditures in this program. This is, one of a handful of very special programs in the department with COVID relief funds. There's a lot of eyes on this program from state leadership, from the federal government, and also internally as well. So please, reach out to us with questions. Be as accurate as possible with your reporting and your timeliness with your reports. So I'll go over a couple of general questions that we had. Frank and I had been replying directly to the group, and then I see we've got a couple of more questions coming in that have not yet been answered. So again, let's see. The recording will be on the website. I think we've shared that webpage several times. Let's see. There were some questions about account access. If you've already set up in the housing contract system, you do need to fill out a new housing contract system access form, because the forms are specific to contracts, not to your organization. You may not have the same staff reporting for your home grant and for something else, and then this grant as well. We just need it per organization. I believe all of those forms have been submitted. If not, we've probably followed up with you directly. There were a couple of questions on the unduplicated counts per month. I feel like these had been answered directly, but if you have any additional questions about unduplicated households per month, please reach out to us directly as you're filling out these reports, and review the guidance as well. Okay, so look over. We have a question about how to submit an advance. This is something that we had covered briefly yesterday, but we can go and we'll cover this a little bit right now as well. So Alex, could you do me a favor? Do you have access to show the website again?
I do indeed.
Okay. I'm not very good with sharing my screen and not shutting down my computer on a webinar. Could you please open up the sample contract that we sent yesterday? I'm ultimately getting to the section where we talk about advances. Yeah. So I think it is page 6 of 47. Okay. So as we discussed, I think we talked about this on Tuesday. Subrecipient agencies do have the option to receive a one-time request for an advance of funds at the beginning of this grant. Going forward, the grant will be run on a reimbursement basis, but if you need a little bit of funds to start the administration of your operation, or you just need an appropriate amount for 1 month's operation, not to exceed 30 days cash need, to start your program, that is allowable. What you would need to do is send us an email with your justification of the amount. There's no set form for this, right? So send it to your designated program contacts, the amount that you would need, how much you want for admin, direct household payments, or housing stability program funds. Break that out with as much detail as possible. If you're going to say we need $10,000 in admin, we want to know how that's going to be broken down and make sure it does not exceed that 30-day cash need. Once you receive that, we'll go ahead and reply back to you in an email, so you'll have it documented that this has been approved. You can go ahead and then submit a draw request in the housing contract system, just like Alex went through, and we will document on our side that this emailed request for an advance ties with this draw request in the housing contract system. Alex, did you have anything else to add on that?
Just two things. When you do the performance report for an advance, then households served, you're just going to report zeros, because obviously no households have been served yet. And that obviously when you do your first reimbursement request in the housing contract system, you're still going to have to submit a report for March, right? So, April, sorry. So on May 16th, you'll still have to submit a report. You're just going to report zeros for households served, and your reimbursement request will be only any funds you need over your advance of funds. Otherwise, you're also going to report zeros.
Yeah. So I do really want to stress here, this is no more than 30 days cash need. If you get into a situation where you're holding on to that advance of funds, it will either have to be returned to us or reported immediately and drawn down. This is only a one-time startup allowable amount of funds, right? You can't just roll this forward If you request the funds and you're having trouble hiring someone or something, let us know immediately and we will work up a plan to make sure that you get those funds spent. You cannot hold on to these funds. I anticipate this might trigger a lot of questions. I'm not really prepared to go into detail about the advanced process right now. Let's get your contracts and your benchmarks signed and ready to go, and then reach out to us directly if this is something that your organization would be interested in. Okay. Let's see. Someone is asking for the CFDA number. That also appears on the contract. Did we put it on the, could you please scroll up, Alex, to the very first page of this contract?
Of course.
Okay, so the CFDA number, this is the federal award number. I think some organizations might need this to seek approval from their board. It's right here, it's 21.023. That's the CFDA number. That's linked through on the Treasury regulations on our website. It will be on your contract and it's right here as well in the sample. Let's see. We've got some questions around a first-time recipient of housing stability funds. Can we go back to those slides and just kind of re-review on the slides or maybe in the household spreadsheet when a household would be a first-time recipient or when they would be reported in subsequent months? I think we could review that.
Yeah, they're a first-time recipient if they received HSS funds from your organization for the first time that month. We're not so worried with, have they received HSS funds from another subrecipient previously, unless you know for certain that they have. Generally, if you've never served this household before with HSS funds, it's going to be yes, unless you have evidence that, another organization has helped them with HSS funds in the past, because it can be difficult for a client to necessarily know, where the federal funding, for a service that they have received is coming from, right? So, it really is just like, have you served them for the first time this month? Then you put yes, and if you have served them in a previous month, then you put no. And there's also ways that I kind of check these because, the first time a unique identifier pops up in my, master spreadsheet of households served with your organization, it should say yes here, generally.
Okay, I think we have addressed all. Go ahead.
I have one thing to note. But one of the things, Meg Key actually just messaged me and told me that this is a good point to make. That on your contract benchmarks, we use the term unduplicated, but it's unduplicated through the life of the program, right? So your benchmarks in your contract are going to be unduplicated through the life of the program. How many households you serve. Meanwhile, reporting is unduplicated by reporting month, right? So I basically take all of this data and I do a run of it that is, unique households served through the life of the program, and that's what we generally report to Treasury, and that's how we will run your quarterly benchmarks. But we still need a log of every household served in a reporting month. So what you report unduplicated by month, right? The numbers I run unduplicated through the life of the program, and that's how we do and calculate your benchmarks. So that is an important distinction.
I'm going to jump in here real quick with another caveat. There's a subset of subrecipient organizations that are currently administering ERA1 contracts, and then will also receive ERA2 contracts. We know, based on your expenditure rates, that you're nowhere near at this point in your ERA1 contract ready to switch over to your ERA2 contract. So we need to develop and deliver some training and technical assistance on how that switch is going to go. So you will receive, direct, focused for that small subset of subrecipient organizations, how to switch over those contracts, how to account for those households that you might be serving in July and August with ERA1 funds, and then in September and October with ERA2 funds. Please hold your questions. We're coming up with guidance that can apply uniformly to all organizations within that special subgroup. So I know that those questions are coming. They're not as urgent right now because you are still currently providing funds and services under your ERA1 contract. And I think you all know this. You will not be able to access your ERA2 funds until you've completely expended your ERA1 funds. So there would not be a scenario where you're overlapping, this two different pots of funds into one household, or, the time for this is not coming immediately. We still have a few months of lead time before we even think about switching over. So if you're thinking about this, I know we've gotten a couple of questions. That guidance is coming. We just want to make sure that whatever we provide is going to be a one-size-fits-all for all organizations, so then we can collect that data uniformly and then report that to Treasury as well. So, okay, am I missing anything that we want to highlight? Oh, someone wants the sample link, the link for the contract. If you go to the HSS webpage, could you go back to the webpage, please, Alex?
I can.
Okay. So on the webpage, this is where everything related to the Housing Stability Services Program lives, right? So up at the top, we have the list of each of the two subrecipient groups from ERA1 and ERA2 funds. Immediately under that is all of the training materials that we have received today. As we get everything, we're completing this training. This will then live all the way at the bottom of the webpage where we have all of our webinars. So all of the slides, all of the handouts, all of the recordings. We're going to move this down to the bottom. Could you scroll to the bottom, please? Where it says webinars. And we'll break out, on this date, we have this training and here are the materials. So all of our training videos and materials are going to be down in this webinar section. And like I said, we'll send out an email through the listserv of when that's all available. My goal is tomorrow to get that all out. Also on this page, I want to point out the monthly reporting deadlines. Alex went over this a few times. In your contract, it says, the 15th of the month following the month for the reporting period. We've changed this slightly and we've put it in writing here. If the 15th falls on holiday or on a weekend, we want to make sure that you're not scrambling in your office on a Sunday and you have a question and you're worried about either submitting an incorrect or a late report. So if that 15th reporting deadline falls on a holiday or a weekend, we've just advanced it to the next working day to submit your reports. I think it only falls on May 16th. So that is the day when it will shift forward. 1 week in advance of these reporting deadlines, we hold office hours. If you're compiling reports or you have questions, please log in, ask questions there, or reach out to us directly with questions. Let's see. I think that is it for questions. Frank and Alex, please let me know if there's anything else I've missed. I'm going to give it just a few more seconds for questions if someone's frantically typing. I don't want to cut you off, but we are ending the end of this webinar. Okay, I think that is it. So yeah, we'll just bring up the last slide. Thank you so much for everyone sticking with us. 3 days of contract training, allowable activities, and reporting training. I know it was a lot. As you absorb this, as you go back through the materials, please reach out to us with questions. We'll get back to you absolutely as soon as possible. And you'll get very familiar with your assigned contract specialist and the program administrator that will oversee your contract. So we're here to help you. We're here to answer your questions. If we don't know an answer right away, we'll get back to you as soon as we can. So thank you so much. Look out for your benchmark reviews, your contracts. Your contracts will be sent via DocuSign to the person that is listed as the signature authority. When you submitted your application, you told us who has the authority to sign. You'll know when the contracts are coming out, but that person that can sign the contracts will get an email via DocuSign for your final executed contract. So stay tuned, and we're very excited for the next 2 years of administering this program. And that's it. Have a wonderful afternoon and a good Friday and happy weekend. I'm going to end the webinar now.